Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, toxic amblyopia. So, as the name says, this is toxic amblyopia or toxic optic atrophy. So, here there are some toxins or there are some exogenous poisons which will result in the damage of the optic nerve fibers. So, because of these exogenous poisoning, the optic nerve fibers are damaged, and this damage is actually seen bilaterally. This is seen mostly bilaterally, and it will also lead to the retrobulbar neuritis. So what are the causes of this toxic amblyopia? Toxic amblyopia can occur due to the cigarette smoking. Number one, tobacco. In the tobacco, actually cyanide is a toxic agent, and this cyanide will cause degeneration of the ganglion cells of the macula. So this is responsible for the development of toxic amblyopia in a patient smoking cigarettes. Then the patient who takes either ethambutol or deficiency of vitamins like thiamine or vitamin B12 deficiency, ethyl alcohol consumption, then even methyl alcohol consumption can also cause toxic amblyopia. Methyl alcohol consumption is more dangerous because it will cause direct damage to the ganglion cells. Because it causes direct damage to the ganglion cells, methyl alcohol is more dangerous. It can cause toxic amblyopia. Drugs like quinine, chloroquine, isoniazid, digoxin, and NSAIDs can also result in toxic amblyopia.
thank you and thank you for watching.